benefit of combining anticoagulant and antiplatelet treatments during PCI?
Well, during PCI, obviously, there's a lot of things that go on in thrombosis. And so we always, try to go against the platelets. They're the first responders. And then, of course, there's also the coagulation cascade. So the benefit there, obviously, is trying to get, kind of antagonize the two parts that go against thrombosis. And so that's really what the benefit would be.
And what are some of the challenges in developing the correct combinations of these treatments?
Well, obviously the biggest challenge is trying to figure out, well, how can we get efficacy but not have the patient bleed, the safety concern there from a bleeding perspective. Because obviously while we're trying to block both of these mechanisms, remember that's also, while it causes thrombosis, that's what causes hemostasis. And so if we don't get that, then the patient's going to be at risk of bleeding, and that's really kind of what ends up being the downside of a lot of these combination therapies.
You recently published an article in AJMC regarding once and twice daily dosing. What are the challenges trying to simplify medication regimens across cardiovascular disease to increase adherence and improve clinical outcomes?
Right. So yeah, you mentioned the paper that we published, and we saw that twice daily regimens were less adherent than once daily, and so that's going to be a challenge. People try to obviously, so dosing. The complexity of dosing is something that drives whether or not how well patients are adherent. But adherence really is a behavior. And so it's going to be things like, more education. I really do believe myself that the more the patient is involved and understands what they're doing and why they're doing it, that they're going to be more involved and invested in their own health care and taking their own medications. But we have to try to do things, limiting drugs as much as we can, using more simple regimens like once-a-day therapies and things like that. But I think really we need to kind of almost enter into some type of really agreement with our patients that we're going to work together, and part of their part is making sure that they take their medications.